A report produced for the White House Coronavirus Task Force puts Utah in a red zone for COVID-19.
Fox 13's Spencer Joseph has gone through Utah's portion of that report and has more on what local businesses would face if those recommendations were not followed. Spencer?
A 359-page report prepared for the White House Coronavirus Task Force outlines what they're calling a red zone. 18 states, including Utah, as well as neighboring states of Nevada, Arizona, and Idaho, that should roll back reopening. The report says, quote, the trend in recent days is very concerning in Utah and is recommending to close bars and gyms in hotspot counties, as well as put strict guidelines on restaurants.
The White House is not afraid of information. I think we see the surge in cases and we know where the hot spots are. We've been very upfront about that.
Senior White House counselor Kellyanne Conway was asked about this report Friday morning.
I don't know which document you're referring to. I only read about it, so I'd have to really take a look at that. But we release documents every day with respect to the coronavirus, and I'm not afraid of getting the information out there.
From one Capitol Hill to another, this morning Governor Gary Herbert's office issuing a statement addressing this new report, saying in part, quote, the White House sends us regular reports on Utah's COVID-19 status, including data and recommendations. The data seems to correspond well with our own data, and we appreciate their suggestions. A government perspective on shutting down businesses is one thing, but a human perspective is a whole other story.
It's definitely disheartening.
Sean Miller owns Park Cafe.
Being a business owner and having employees that depend on this, it's definitely a tough pill to swallow for a lot of us if it does come to that.
He says for himself, as well as other restaurants and bars, they're nervous.
With the White House saying, they're hoping to close bars and gyms down especially, and the people that own gyms and bars are really going to have to hope that they save through this little bit of period while they were open.
Safety during this pandemic is the paramount concern, but with one shutdown already over, another would have even longer lasting impacts on the state.
The fact of the matter is if people are getting sick, we have to do what the state says, and that's mostly I feel like we're all trying to do our best to stay safe.
The governor's office also telling us their response to the coronavirus is far more specific to outbreaks in the state of Utah. Max, Kirsten?
Spencer, the governor's office weighing in, but what does the Utah Department of Health say about this report?
Well, they're well aware of the report. They do get state-specific versions of this report, and they gave a statement to us saying today in part, quote, the White House Coronavirus Task Force has published weekly state-specific snapshots for several weeks now. The report provides a concise look at the current situation in Utah, and they also emphasized to us this is just one of the many factors they look at in the state's response to the pandemic.